Yeah. So this happening is called stress, anxiety. Correct? So see, you must be feeling this throughout the day. From morning to going to bed, you've been feeling stress here, head, but we are not aware of it. We are never aware of it, right? Okay. Now, whenever we have to do something, or for example, I need to do something in front of everyone, I have some sensations, and that can trigger different reaction in my body. One of it is this, okay? Another is palpitation. Third one is tingling sensation. Correct? Yeah. Okay. So psychodynamic psychotherapy. Why psychodynamic psychotherapy? We have CBT, we have REBT. Why psychodynamic psychotherapy? Any reason you can tell me? इतनी थेरेपीज है CBT REBT, फिर ये नया क्यों चाहिए? Yes, it's something which will work on the past experiences from us childhood. Anything else? Yeah, unconscious. Anything else? Hidden separation, that's what he said, subconscious mind. और कुछ? Yeah, understand trigger. But ma'am, CBT में भी we understand the trigger. Yes, we can connect it with the past. Yeah, dynamics. Okay. Yes.
Because the perspective is changing towards the past experience every time as we grow up.
Yes.
So every time we see that situation, something what we feel is traumatizing.
Yes.
We have a different perspective. That's why psychodynamic,
Yeah.
because it is changing.
And we need to understand why I'm behaving like that in that moment. Yeah, dynamics. Yeah, this word she used, awareness. Yeah, yeah, correct, 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 perfect, perfect. Okay, so as I said, uh, एक दिन आ जाओगे आप चेयर लेके? As I said, we have used CBT, REBT. It's usually like on the current problems, okay, on symptoms, anxiety symptoms, but there's something which addresses the root causes, okay. This lecture would be on the line of what ma'am has just presented, how our mind works. So something on the root causes and not just on the symptom, okay. Long-term growth. Okay, when we understand our pattern, how I behave, how I look at things, what are my patterns, thinking patterns, that helps in long-term growth. Okay, next. Okay, there are something called treatment resistant cases. We have been treating them, giving them medication, giving them therapy session, and they are not resolving. This is my personal experience. One of my client, who is my client since 2018, one of my initial days. She been with me for so many years, and now when I approach her with psychodynamic, she has been understanding herself in a much better manner. She has been able to reduce the fight with her mother. Okay, she was very aggressive. Means anything happens, she will blame her mother. क्या आपकी वजह से आपने मेरे साथ बचपन में ऐसा किया, यू बीन ट्रीटिंग मी लाइक गार्बेज. But this approach has brought changes because this has helped to go back and see why this is happening. Okay. Then personality disorder, borderline. Their main issue is What is the main issue in personality disorder, borderline personality? Low frustration tolerance and yeah. So low frustration tolerance, anger outburst. There it is very good. Relationship patterns. I will give you examples as we go ahead. I will give you example how relationship patterns also get affected. Okay, because even after understanding that this is my thought process, but my behaviors stays same. Okay, I know ki if I talk in front of you, you are not going to eat me. Nothing is going to happen. But every time I come here, I feel anxiety. Cognitively, we know nothing is going to happen. You are not going to eat me. This is just a exam or this is just an interview. But we keep feeling emotions, right? Because what happens most of the time we work on cognition. Okay, there are three aspects: na? Cognition, behavior, and emotion. Cognition is cognition is nine. Cognition is thinking. Behavior is how we behave, and emotive is how we feel. So unless we work on all the three aspects, and specifically emotion, it will not help us. Okay. Next, and this is much of a insight building. This is about understanding self, how I behave. Okay, and it helps overall in personality changes, right? Patterns, behavior patterns. Next. Okay. So now let's see that you are all student, right? Some of you must be practicing psychologist also, right? So when you see a patient, what is the first thing you do? Anyone? First thing what you do? Huh? Uh, okay. But I'm just coming to you now. What is the first thing you will do? What? Okay, how are you? What is happening with you? Okay, what is your target? What do you want to know? Yeah, what she is feeling which brought her here. Yeah, so question is yes, anything else? Specific? How may I help you? Reason or what made you come here? कुछ और इसमें ऐड करोगे कोई? हाँ? Yeah. What is the emotional feeling you came here for? Correct? Okay. If I ask you, how are you? What will you say? Even if you came to me for therapy, what will you say? I'm good. Yeah? And then we just keep talking 5-10 minutes, 10 minutes हो गया. Then we remember, अरे problem क्या है? आप आए क्यों? Happens. So first thing is, what is the emotional problem you are here for? Okay. Now tell me, whenever you ask any person, what is the emotional problem you are here for? What is the response? Majorly. Like example, specific. Yeah, I'm good, I'm here to see you. Anything else? Yeah. Yeah. Lot of thing at the same point. Yes. Yeah, I have asked the person what is the usual response there. Do they give you specific problem most of the time? हाँ, symptom. Yeah, yeah. So they just give you things like maybe how are you, वो आपको ही पूछेंगे, right? They may tell you that दो चार दिन से ऐसा हो रहा है, right? They may tell you something else. Okay. So what exactly that person is doing? That person is not giving me exact answer, but what that person is giving, what the person is doing. Avoiding. Yeah. Yeah. So ma'am said a very important thing that the person is not aware, but it's happening. What is it? What it is called? Huh? Yeah. Okay. If you ask me what is the emotional problem I came here for, and I start complaining, नीचे पार्किंग के लिए जगह नहीं है, रास्ते से आया वहां पे पूरा गाड़ी लगा है, पूरा कचरा है, कोई साफ ही नहीं करता है, वेटिंग एरिया में वो असिस्टेंट भी आपकी कितनी रूडली बात करती है. आई स्टार्ट कंप्लेनिंग. व्हाट आई एम डूइंग? Okay, venting, but what is it? See, you are a psychology student, right? Tell me the process, what is happening. If I'm not answering your question directly, what I'm doing? Wait, suppression. What is it? What is it? What is suppression? Defense mechanism, right? First thing is, whenever you ask any person give defense, and as ma'am said, it is not conscious. It doesn't happen intentionally. It happens at the subconscious level. What is the second thing that happens? Okay, realization. One is defense. Second is
Denial.
uh, deny is defense mechanism. Denial. कि मुझे तो सब आई एम ओके बट माई वाइफ सेड कि यू मस्ट गो टू सेशन सो आई केम हियर. आई एम डिनाइंग. So this is, what is this? Defense. So one is defense. Second, yes. Okay, okay. Let's go back to my first question. When I came on the stage, I asked you something, anxiety. Second response is anxiety. If I ask you how you've been feeling, my response would be anxious. I will start feeling palpitations. I will start feeling tremors, right? And third is emotion. I may tell you what exactly I'm feeling, right? So now, to explain this better, I want two of you to come here. I have given you sheets, right? So with those sheets, any two people who are willing should come here. Two people. नहीं आई कौन आएगा? आई वॉन्ट स्टूडेंट. ओके. हाँ, स्टूडेंट्स. ओके, कम कम. आ जाओ आ जाओ आ जाओ. सी क्या हुआ अभी? एग्जैक्टली क्या हुआ? जैसे मैंने पूछा आपको स्टेज पे आना है, चेयर ले लो, एक एक चेयर ले लो. जैसे मैंने कहा आपको स्टेज पे आना है, क्या हुआ? व्हाट हैपेंड? एंजाइटी. सी, कैन यू सी हाउ यू गॉट एंशियस व्हेन आई आस्क यू टू कम हियर? सो व्हेनेवर वी इंटरैक्ट विथ एनी ह्यूमन, आप बैठ जाओ ना. नहीं, सिट लाइक दिस, सिट लाइक दिस. या ऐसे करो. या सिट लाइक दिस. So when, as soon as I asked you to come here, what was the response? Anxiety. So whenever we interact with anyone, we interact emotionally. We either show defense, we either get anxious, or we give feeling. Okay. Now the first page, okay, first page. So I will read the pre-log and then we'll go to exercise. So first page is getting a specific example. Whenever we ask any client, they start giving you defense, right? Different kind of defense, and we are going to see how we are going to identify the defense, or we are going to break the defense. Okay. So as I said, patient can give a specific example or anxiety which is too high or defense. These are the three usual responses. Okay. So turn the page. Yeah. Who will be therapist? आप में से you therapist? आप patient? Yeah. Hold this. एक mic. Yeah. Okay. So आप patient हो ना? See. You need to say this statement. What is the feeling towards maybe your friend for doing that? Okay, itna hi. Okay, so keep on your. Then what he will do is he will read from here to here, and you will read the bracket statement. Okay. Okay. So what she is going to do is she is going to say what is the feeling towards maybe your friend for doing that, and you will read this statement, and she is going to read the remaining statement. Okay. Okay. So you can choose a statement. What do you feel towards your uh, wife for uh, for ignoring you? Yeah. Yeah, you are patient, so you will read this from here to here. Complete. It goes till here. Okay. Yeah. 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 What do you feel towards your wife for ignoring you? Yeah. Good. So everybody listen what they say, because it will show how patient react with you, how patient respond to you while therapy. Okay. Good.
What is the feeling towards your wife when she's ignoring you? I can't think of specific situations where it's a problem to me. And if we don't have a specific situation when it's a problem for you, we won't be able to get a clear picture of your problem. So, could we look at a specific example? I'm not sure. It's a specific problem. It's more of than a general kind of problem. Okay, that's way. Could you be more specific about the problem you would like me to help you with?
Wait. So what the therapist is trying to do is, therapist is trying to bring the patient to the specific problem. She been asking the patient that your wife has ignored you, and what do you feel about it? And what the patient is doing, giving you different defenses. Okay, right? Ha. Go ahead.
Oh, there are so many examples. I can't think just one. Okay. And if we don't look at one example, we can't get a clear picture of your problem. And then we wouldn't be able to help you. So could we look at a specific example? She just dismiss you as a person and I don't like it. Okay. So could we look at a specific example so many times she ignored me. What I say to her. So could we take a look at a specific example? Just a day, I asked my husband to take out of the garbage, and she said she would, but he insisted. He asked a 5-year-old to me, and garbage spit out to the back all over the sidewalk because our little boy this reached the garbage and I didn't say anything. So what is the feeling towards your wife for doing that.
wait. Now see, for 5 instances पेशेंट ने सिर्फ डिफेंस दिए. फर्स्ट पेशेंट सेड कि मुझे कोई स्पेसिफिक एग्जांपल याद नहीं आ रहा है. देन शी पेशेंट सेड कि आई एम नॉट श्योर कि यही स्पेसिफिक एग्जांपल है. देन पेशेंट सेड कि बहुत सारे एग्जांपल्स है, मैं कौन सा बताऊं. एंड उसने देन जस्ट जनरल स्टेटमेंट दे दिया कि वो बस मुझे डिसमिस कर देती है एज अ हस्बैंड, वो मुझे वैल्यू भी नहीं देती है. Then he just said कि she ignores me. So he just said कि वो मेरे साथ क्या करती है, बट उसने आखिर तक स्पेसिफिक एग्जांपल नहीं दिया. इन लास्ट स्टेटमेंट द पेशेंट गिव द स्पेसिफिक एग्जांपल दैट मैं हमेशा उसको बताता हूं कि भाई वो गार्बेज तुम फेंक दो, राइट. बट उसने क्या किया, उसने बच्चे को बोल दिया. बच्चे ने फेंक तो दिया, बट क्या किया उसने, या बट अभी भी उसने फीलिंग बताई क्या, नो. पेशेंट डू द स्पेसिफिक एग्जांपल बट अभी भी वो स्पेसिफिक फीलिंग पे. लेट्स सी व्हाट हैपन नेक्स्ट. ओके. हाँ.
I really am angry with how she has abused me when she's drunk.
Okay, wait. Now did he give the specific feeling? Yeah, anger, right? I really am angry. Anger is a feeling, specific example, and what he feels toward his wife. Great. Okay, go ahead.
So, could we take a look at a specific example? Well, let me know you all how we meet. It was there, it was 3 or 4 years ago in this. Coming back to today, could we look at a specific example of where this is problem of your. This is a problem of saying me so much and taking all these meditations and medications, and then I have to see all these doctor. Coming back to your problem, could we take a look at a specific example where this problem comes up for you? As you know, ask me for a specific example where my son come home and run my stomach and started getting
Nauseous.
that's a sign of anxiety. So we see that as soon as you think of a specific example about your son coming drunk, you get anxious and then your stomach gets nauseous. Do you see how that just happened?
Wait. Wait. Huh? So now the therapist has started asking the specific feeling. बराबर. हाँ. And patient said कि I'm angry. But then next उसने क्या किया? Can I tell you history? Yeah. So what was it? So what was it? Was it a feeling? Anxiety? What was it? Defense. Vagueness. Vagueness is defense. Okay. Then he again said that ये प्रॉब्लम की वजह से मुझे मेडिकेशन लेनी पड़ती है. दैट अपसेट मी. राइट. नाउ ही इज गिविंग यू अनदर इमोशन. ये सब की वजह से व्हाट आई एम गोइंग थ्रू, आई एम टेकिंग द मेडिकेशन. But what patient is doing, again giving you distraction from the problem. So what is it? Defense. And then he said I feel nauseous when I talk about it. Okay. So what is when a patient feel nausea? Okay. It has been written that it is a anxiety. Feeling nausea is a anxiety. Okay. See, we have smooth muscle in our body, striated muscle which are outside, okay, and sensory system. When the anxiety is moderate, so it affects your smooth muscle. So we start feeling headache like this. We start feeling palpitation. We start feeling breathless. Stomach get upset, so we start feeling nausea. We start feeling burning, urge to go to bathroom. These are all smooth muscle anxiety. Okay? Okay. Let's see what happened next. Okay.
These are not really specific example of that because this is a really more matter how we related to each other in our family. This is very low. See, if we don't get a specific example, we won't be able to get a clear idea of your problem, and we won't be able to help you with it. So, could we look at a specific example of this problem? I think you are really understanding me now. And can we take a look at a specific example of where this is a problem for you or where it is really fun? I don't mean it's giving a wrong impression. That's wonderful. So, can we take a look at a specific example where this is a problem for you? Well, maybe we are just dealing with a midlife crisis in our marriage. That's a possible explanation for your problem. So, can we take a look at a specific example where this is a problem for you? Oh, my patient.
Parents.
Oh, my parents, where are so horrible to me. I cannot even stand to visit their houses. So can we take a look at a specific example? I keep wondering whatever I should go back to my
Girlfriend.
girlfriend. Even though he was a bit when she was drunk and she could do me sleep when she was sober. So can we take a look at a specific example of when she was bad and drunk? I keep wondering whatever I should do back to my girlfriend, even
You are reading it again.
okay,
Yeah.
when there would be a problem, if I could be figure out a way to discover my wife without
Divorce.
unable
Divorce my wife.
divorce my wife without losing access to things. But there is a problem you say. So can we take a look at a specific example where this problem comes up for you? I don't know. I was hoping you could tell me. Only you can know of a specific example where this problem comes up for you. I should probably just give up on man and tired baby and they are on the same. But this doesn't give us a specific example where this problem comes up for you. Could we take a look at a specific example? I suppose I wouldn't talk about the time she threw the engagement ring into the gutter, but that is probably not a good example. Would you like to take a look at it so we could get a clearer picture of your problem? I remember when I introduced my wife to my parents, many years ago now we had a wonderful dinners and my relatively were these. My uncle, my aunt, all were from out of our street. I was so happy. It was quite a wonderful occasion. We still have our pictures of our wedding. We had it is a church as my brother's list, but the reception outcome afterward was the way one day. Absolutely wonderful. That's great. But we still don't have a specific example of your problem. Could we take a look at a specific example of your problem so we could get a clearer picture of what is troubling you? I remember when I got married, my father spoke at family dinner night before he said in front of everyone what a failures I had been designed and how ugly. I was glad many women would want to marry. I had to sit there silently while she kept putting me down in front of everyone. For some reason, I got really distressed after the dinner. What is the feeling towards your father for putting you down?
Wait, that's it. Huh. So now, give me the mic. So now talking to client, okay, and he is giving you so many different responses. How do you feel?
Generally,
Emotion. What was? Huh?
it is emotion. I feel
No, his emotion. You've been asking him the question. Give me specific example. Give me specific example. Give me feeling. He was giving you stories. What it make you feel?
It was kind of frustrating and
Frustration, yes.
I was also feeling happy I'm keeping asking him the same question. The specific specific
हाँ.
give me specific example and all. But
So
there
कैसा फील हुआ?
was
How कैसा फील हुआ उस वक्त?
it was frustrating for me as well.
Yeah. So does it happen? ऐसा होता है क्लाइंट के साथ बात करते हो? Yeah. We keep asking them, and they don't give you example specific, and it frustrates us. Right? On the second page, last two things. Our marriage is really fine. I don't mean to give you the wrong impression. है ना? हम हमारे वाइफ के बारे में बात करने आए हैं, हमें उससे इश्यूज है, बट वी स्टार्ट प्रेजिंग हर कि नहीं वो वैसे अच्छी है, हमारा मैरिज भी अच्छा ही है. व्हाट आई एम डूइंग, या बट व्हाट इज द डिफरेंस? Yeah, we are denying, and what we are doing with the wife image? Idealization. Yeah, this is called idealization कि वो अच्छी है. Yeah, there is no problem because many times we have a problem but we are not able to accept कि how I can complain about my wife. Correct? Yeah. After that, maybe we are just dealing with a midlife crisis in the marriage. I don't want to talk about the problem. I'm just labeling कि वो midlife crisis है, बच्चे हो गए, अभी हम सब सेटल हो गए, अभी क्या करें? Right? Defense. Okay? How you felt while answering her?
Frustrated I'm frustrated when she asked the repeated question.
Yeah, 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 yes, yeah. It's really frustrating. Yeah, बहुत frustration आता है कि वो बार बार एक ही सवाल पूछ रहा है. अरे स्पेसिफिक एग्जांपल दो, स्पेसिफिक एग्जांपल दो, राइट? हाँ, बट इसमें जितना फॉर्मली लिखा है उतना फॉर्मल वो नहीं होता है. वी नीड टू बी मोर एम्पैथिक because they were just reading it, they were very straightforward, but in those we need to have a modulation, this voice modulation, we need to pause, we need to reflect and then go ahead. Okay, but this is what is a problem. Whenever we go for a therapy session, we give defense, we just do defense, we deny, we idealize, we just minimize the problem, we just try to suppress कि I'm not feeling anything. Yeah, project. Yeah, okay, thank you, take your seats. First, clap for them. They have ignored the anxiety and came to the stage. Okay, okay. So this was how the first encounter looks and what we face in the situation. Okay. Okay. So you must have seen that some people when come to chamber काउंसलिंग के लिए आते हैं तो सीधा ही रोने लग जाता है. Those are the fragile patient. Okay, emotionally fragile patient. They start crying. But most of the patient who have moderate to high resistance, okay, they will give you defenses, various defenses. जितने भी फ्रॉइड में दिए सब डिफेंस वो यूज करते हैं. Okay, okay, next. Okay, beta. So we have seen कि whenever we need to do something, we get anxious. है ना? आपको आपके हस्बैंड के बारे में, वाइफ के बारे में, पापा के बारे में, मम्मी के बारे में, किसी के बारे में भी कंप्लेन करना है तो फर्स्ट गेट एंशियस. ओके, सी as I said, there are three kind of anxiety level. One is CPD, cognitive perceptual disturbance. Second is smooth muscle, and third is static muscle. Okay, cognitive perceptual disturbances. आपने सुना है ये वर्ड? ओके, व्हाट इज इट? एनी एग्जांपल इफ यू कैन गिव? यस, काइंड ऑफ illusions और perceptual disturbances. कौन कौन से perception है? Which are ear, means hearing, vision, smell, taste, touch. Okay. So here what will happen? tinnitus. Many time when we get anxious, कुछ आवाजें आने लगती है, सुई ऐसा, तो वो कम हो जाता है. जब तक आप एंशियस एंशियस हो वो रहेगा, बाद में चला जाएगा. सेकेंड, मेनी टाइम लाइट स्टार्ट डिस्टर्बिंग यू, हाइपर सेंसिटिव, लाइट भी सहन नहीं होता है, राइट. देन somebody said tingling sensation, sorry, touch sensation. These are the perceptual disturbances. And whenever you see this, जब भी आपको ऐसा दिखता है, understand the anxiety is too high. You can't touch emotions feeling at that moment because anxiety is very high. So at that time, you should just stop. You should not push anything more because the patient may get fragile. Okay? Okay. When the anxiety is bit low, it comes to smooth muscle. I just said about smooth muscle, right? Smooth muscle which are inside our body. Palpitation, breathlessness, right? Acidity, nausea, headache, pulsatile, pulsatile. Okay. Then you get frequent urination, right? These are smooth muscle. Okay. I said pulsatile because there is one more headache which is not smooth muscle. Okay. बहुत बार ऐसे कुछ बांधे जैसे लगता है, राइट. एंड दैट इज स्ट्राइटेड मसल. ये जो बाहर के मसल्स है ना, स्ट्राइटेड. ओके. स्मूथ मसल के बाद में एंजाइटी आती है आपके स्ट्राइटेड मसल पे. आपकी इसमें स्टिफ लगेगा, राइट. देन बॉडी में डिस्कम्फर्ट होगा, टेंशन हेडेक होगा, राइट. नेक पेन होगा, राइट. Yes, prolonged non-specific pain. Whenever I go to office, my head start bursting, right? Non-specific pains. Those are also started muscle anxieties. Okay, you understand this? Okay. Why we get anxiety? Whenever I ask you any emotion, why I get anxiety? If I ask you, okay, आपका और आपके मम्मी में क्या झगड़ा चल रहा है, and you get anxious. Why? Fear of, okay, fear of being judged. Anything else? और कुछ? वो तो काइंड ऑफ एंजाइटी हो गया. माय क्वेश्चन, हाँ.
Because we are unsure that how we are going to do or how we are going to deal with the situation.
So that is anxiety. I am getting anxious. But the question is, मैं एंजाइटी क्यों फील कर रहा हूँ?
We have a different picture in our mind for some particular situation or person, but we are facing the
Can you be specific? Okay.
fear of not being understood.
Yeah, maybe I'm projecting on you that you may not understand me. Yeah, but this doesn't answer my question. My question is very specific. कि अगर मैं आपको कोई इमोशनल प्रॉब्लम पूछ रहा हूँ, why you are getting anxious? क्यों आपका धड़कन तेज हो रहा है? क्यों आपका बॉडी स्टिफ हो रहा है? क्यों आपको हेडेक आ रहा है? Why? हाँ. हाँ. Yeah, you are getting anxious, but why? Why you are getting anxious? Get activated, but why? Question is why?
Because the
Now you are coming near to the point that I'm touching the experiences. Yeah?
against my
Against,
against full and small.
that is defense, idealizing. Yeah. See, you have been telling me about correct answer, but the correct answer is कि see, he is a third person. Now मुझे ये मेरे रिलेशनशिप के बारे में पूछ रहा है, राइट. मेरे और मेरे वाइफ के बारे में, या मेरे मम्मी के बारे में, राइट. या मेरे और मेरे पापा के बारे में, राइट. So what happens whenever we touch feelings? It is subconscious. We've been hiding it. Suppression क्या होता है? Suppression, repression. What is suppression? one of the defense mechanism. What is suppression?
We are not hiding it, but we accepting it and suppressing it. We are not hiding.
Okay,
Supposed to do, but we are doing.
okay, थोड़ा और स्पेसिफिक बता सकते हो? You are correct, but
Against the reading.
okay. Anyone else want to try suppression? Yeah. हाँ. And why we do that? Yeah. So we are protecting our ego. We are protecting our ego. And these are all to protect ego. What my ego does is it suppresses the emotions. Right? And because it is suppressed, where it goes? Yeah, unconscious, subconscious. And whenever we try to touch anything in subconscious, unconscious, we face anxiety. एंजाइटी इसलिए हो रहा है बिकॉज नाउ वी आर एक्सेसिंग द subconscious. So imagine if I'm asking you and you are giving me this. So what is getting activated? My striated muscle, my anxiety. So I'm touching the correct point. Now I'm able to. Otherwise, I will just go on defense. I will take you for a ride. History, कुछ और बताता हूँ, ये reason होगा, right? But whenever we touch subconscious, it first trigger your anxiety, and you can actually see it in the client. You can see that patient is giving a sigh, or patient is getting like this, yeah, or patient suddenly coming close, I say, yeah. So he's allowing me to access his subconscious, started muscle. See, even observing a client is very important. Many times what happens, we talk with a client and we are doing something down, maybe scrolling, messaging, yeah, we will miss subtle signs of anxiety. Okay, so in psychodynamic, it is very important to be completely focused on the client reaction. Okay, then these are the defenses: repression, reaction formation. I'm not able to see this. Okay, and then point is, if I identify that it is anxiety, okay, then first is I need to identify whether patient is giving me defense or getting anxious. If patient is giving anxiety, I need to help client control the anxiety. If patient is giving defense, I need to break the defense and move ahead and bring back to emotions what I feel. Correct? Okay. No, wait. Back. Now, if a patient is getting very anxious in front of you, not CPD होगा तो we need to stop. Okay, but patient is having anxiety, maybe palpitation, maybe breathless, maybe having fine tremors in your hand. What will do? हमें अभी उसको अगर थेरेपी में लाना है, will my anxiety help? Smooth muscle anxiety, will it help? No. So what I need to do? I need to control the anxiety. How we do it? म्हणजे कसं? काय?
Calm down their senses
How?
by breathing.
Okay, so Neha is saying breathing, deep breathing. Anything else? Okay, ये सेशन डन. चलो उधर EMI करेंगे. Anything else? Both are wrong. और कुछ? See, I don't need to leave the session, right? I'm in mid of a session. I don't need to terminate it there and go in different direction. Otherwise, it will lose my goal. Deep breathing. This is the common things we do. Mistakes. चलो अभी ऐसा करो, मेरे साथ काउंट करो. आई विल काउंट. डजंट हेल्प. डिस्ट्रैक्ट हो जाएगा. इमोशंस फीलिंग लूज हो जाएगी. टेल मी हाउ. Common sense. We have been taught.
make talk, let him express his feelings about past, or let him talk.
Okay, but now he is getting anxious, and anxiety will block your feelings. If you are getting anxiety, it will not help you tell me how you feel, so it will get blocked. If I ask you, tell me more about it, and I'm getting anxious, will it help? No, it will not. So first step is controlling the anxiety, and question is how.
If I reassure them,
Go ahead, go ahead.
I'm not judging you like that.
Okay, I'm not judging you, I'm listening. Okay, but he's not anxious because you are judging me. He's anxious because he's touching his subconscious emotion.
So first of all, we can offer him a glass of water so that he will be just it will break his
Okay.
thoughts and all, and
Yeah,
so
yeah,
that we
yeah.
can control the
Yeah.
situation.
Glass of water. Okay.
By showing
Okay, let me do that. But I'm happy that you are giving responses. You are thinking. I'm very happy about it. Okay. See, everybody has different triggers. Okay. If I'm getting anxious, it may trigger my heart rate. It may trigger my breathing. Okay. It may trigger my striated muscle. Okay. Now, at the initial phase, when I said आपको यहाँ आना है तो muscles ऐसे हो गए. Okay. What I will say? Okay. I can see you are getting anxious. Where exactly you are feeling the anxiety? What would be your response? Different, right? Somebody would be feeling palpitation, somebody would be feeling breathless. I just need to tell the patient, for example, I'm the patient, I'm getting anxious. Just locate your anxiety. Okay, doctor, मुझे ना अभी यहाँ पे दर्द हो रहा है. जस्ट फोकस द पेन. आपको कैसा दर्द हो रहा है? जस्ट फील इट. डोंट ट्राई टू सप्रेस इट. डोंट ट्राई टू एलिमिनेट इट. Don't try to ignore it, just feel it. Now, example, if I just focus on the palpitation at that moment, or breathlessness at that moment, or the stress at that moment, I'm just focusing there. I'm not blocking it. I'm not trying to counteract it by deep breathing or GPMR. I'm not doing it. What will happen? Hmm? It will go down. Yes, it will go down within maybe 4 minutes, 5 minutes. Yes. Now I'm touching the unconscious and I'm blocking the anxiety, and then what will happen? He will, yeah, he will open up to the problem, right? He will be able to tell me the feeling, correct? So can you see that anxiety is a sign that I'm in a correct way. But if the person get anxious, keep getting anxiety, it is not going to help the person. So I need to block it. Okay, block when it is in smooth muscle or the started muscle. Okay, and then it will help me move ahead. Okay. In many cases, if the anxiety is very high, and if you are not able to control anxiety or block the anxiety, we may need medication. Okay, we may need medication if it is not happening with behavior. So that if I am able to control it by beta blockers, propranolol होता है, टिजोलाम होता है, clonazepam होता है, mild, so that मुझे anxiety नहीं होगा and I will be able to access my feelings emotion. Okay, correct? Okay. Next. Okay, ये मैंने बताया कि started muscle में anxiety low होता है, smooth muscle mid, CPD very high. Okay, and this is helpful. Started muscle anxiety is correct way to go. This need to focus on anxiety control. This we need to stop. We can't go ahead. Okay. नहीं तो बहुत बार क्या होता है, while therapy in counseling, patient land up into आता वो normal है and goes by very anxiety panic. because we are helping him to connect his subconscious, but we are not able to help him control the anxiety. Okay, so these are the mild observation which we need to focus on. If you are not able to focus there, it will not help us. This I told you why defense, because it is moderate to high resistance, happens at subconscious. Now I again need to take an exercise, but it will take 10-15 minutes. So do we need to take a break? We'll break for 5 minutes. There is a tea. Okay? Huh? Okay. Till then we will show the video. Huh? तेच तो मागची जोडी झाली. आपण थांबायचं की जायचं पुढे? Ready? So just, but just for 5 minutes, so you can take the cup and sit at your place. Huh? You don't have more time. Okay? Yeah. Yes. So it is very difficult to convert it into Hindi and say it. But अगर आपको नहीं समझा, you just raise a hand, ask me. Okay? Ready? चालू करें? Okay. So हमने ये देखा कि हम डिफेंड क्यों करते हैं, राइट? बिकॉज ऑफ रेजिस्टेंस. ओके, एंड ये कॉन्शियस नहीं होता है, हम जानबूझ के नहीं करते. इट हैपन एट द सबकॉन्शियस लेवल. ओके, विक्रम अपनी पेपर कौन आ रहा है अभी? हाँ, बैठ जाओ, आ जाओ, यहाँ पे जाओ, ये पेज पे. हाँ, यहाँ पे बैठो. हाँ, बैठ जाइए. होल्ड माइक. Okay. Now what we are going to see is कि how to block the defense, है ना? Patient is going to give you defense and you need to understand how to block it. Okay? आप में से therapist कौन बनेगा? Client कौन बनेगा? You will be client, आप therapist. Okay? देखिए, आप therapist हैं तो आप पहले सिचुएशन पढ़ेंगे. PH is your name. Okay? And आप यहाँ तक पढ़िए. ये आप भूल जाइए, ये ठीक है. देन यू विल से, और इसमें व्हेन ही से आई फील स्केयर्ड आप ब्रैकेट पढ़ेंगे. यू विल रीड दिस, आप ये पढ़ेंगे. मैम पहले सिचुएशन पढ़ेगी, ये पढ़ेगी, फिर यहाँ पे आएगी आणि यू नीड टू रीड दिस पेशेंट ब्रैकेट मैम पढ़ेगी. ठीक है? ओके, ready? Okay, ready to see how we are going to see the defense and block it. Okay.
Situation is a man has verbally abused the patient viciously while they were at a church attending a French wedding. The patient's anxiety is in straining muscle. What is feeling towards him for doing that?
You read this also. आप ये भी पढ़ो.
That's my thought. But what is the feeling towards him for verbally abusing you? I feel scared. That's your anxiety. If we look underneath the anxiety, what is the feeling towards him for verbally abusing you?
Wait. So now he has said, I feel scared. But whenever a patient gives anxiety, he also gives the sigh. Means I feel scared, right? So this sigh is uh, anxiety will always be associated with the striated muscle reaction. So, as a therapist, we also have to notice the sigh before client say that I'm scared. Okay, and that's a sign of anxiety in distractedness. Okay, good.
Notice the silent one, he said scared. That is the sign that anxiety is in static
You can go.
mode.
You can go here. Say this again. What is your feeling towards him for doing that, and he will start from you. Every time you say this, he will choose the statement. Okay.
But what is the feeling towards him for doing that?
Go ahead. Yeah. Yeah.
I feel he should not have done that. That's your thought. If we do analyze the thought, what is the feeling towards him for verbally abusing you? I feel betrayed. That's what he did. He betrayed you. So what is the feeling towards him for doing that? I was not happy. That says what you don't feel, but it doesn't say what do you feel towards him. What is the feeling towards him for verbally abusing you? I should only tell you about my history. If we read history, your history to the side, what is the feeling towards him for verbally abusing you? I feel disappointed. That's what he did. He disappointed you. What is the feeling towards him for disappointing you? He pushed a hot button. That's a big way. If we do look under the vagueness, what is the feeling towards him for verbally
Wait.
abusing
Wait.
you?
Wait. 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 So when a client say that he pushed a hot button, it's mean कि उसने मुझे बहुत चिढ़ा दिया. Okay. Hot button is चिढ़ा दिया. उसने बहुत मुझे गुस्सा दिला दिया. Okay. And that's the vagueness what therapist is saying. Okay. Go ahead, ma'am. He pushed the hot button. So you need to again say.
That's a big way. Okay. What is the feeling towards him for doing that? I feel shaky. That's your anxiety. But anxiety is not your feeling. Anxiety is how you are covered with feeling. So if we look underneath the anxiety, what is the feeling towards him?
Go to next. I feel happy. Go to next. I feel happy.
I feel happy. You are happy he abused you. What she did this then say. You are happy he abused you. I feel I should. That's your thought, but thought is not a feeling. So if we look at the thought, what is the feeling towards you for verbally abusing you? I feel let down. That's what he did. He let you down. So what is your feeling towards him for doing that? It's difficult to say. Difficult to say is a way. If we look at the ways, could we take a look at the feeling towards him for verbally abusing you? I feel I don't want to talk to her again. That's your thought again, but your thought is not a feeling. So if you look at the thought, what is the feeling towards it for verbally abusing you?
Wait. So see here, so nicely, he said that I feel I don't want to talk to him again, and the therapist said that's your thought, but your thought is not a feeling. And if we look under the thought, what is the feeling towards him for verbally abusing you? So what is happening? Patient is giving thought, a defense. We are telling that you are giving me a thought and not the feeling. So what we are doing? हम क्या कर रहे हैं यहाँ पे? Challenge. We are reflecting that you are giving me defense. We are reflecting. You are just giving, not giving the feeling, and giving me thoughts. Okay. Go ahead, ma'am. You start from I feel like to. Yeah.
I feel like I made the right decision to leave her. That's your thought. But your thought is not a feeling. So if we look at the thought, what is the feeling towards it for verbally abusing? I feel like that's what he did. He lied to you. So what is your feeling towards him for doing that? I feel nervous. That's your anxiety. But anxiety is not your feeling. Anxiety is how you cover your feeling. So if we look at the anxiety, what's the feeling towards him? I feel like I don't want to marry her now. That's your thought, but your thought is not a feeling. So if you look at the thought, what is the feeling towards him? I think she is. That's your thought again, but your thought is not a feeling. So if we look under the thought, what is the feeling towards him? I feel sad. Sad sadness is between you and you. What is the feeling towards him for verbally abusing you?
Wait. Just give me mic. हाँ. So now at this moment, patient ने कहा कि I feel sad. Yeah, but the therapist is again asking the next question that this sadness is between you and me. This is what you feel. This is what she did and that made you feel sad. But is it giving me feeling what I feel towards her? क्या मुझे ये बताए कि मैं उसके प्रति क्या फील कर रहा हूं? नो. What is happening here? Difference है, but what exactly is happening here? क्या हो रहा है? Yeah, kind of internalizing, correct? Or, okay, by saying that I'm feeling sad, what I'm trying to hide, what I'm trying to hide towards,
Person abused.
see, this is called protecting the figure, right? Okay, हम किसे प्रोटेक्ट करते हैं यूजुअली? Okay, but here that I feel sad and I'm not expressing that I feel anger towards that person, which is very important to me. So I'm protecting that person. मैं ये नहीं बोल रहा कि मुझे गुस्सा आ रहा है उसके बारे में, मैं ये बोल रहा कि मुझे बुरा लग रहा है. ओके, अब मुझे ये बताओ कि इफ यू जस्ट गो ऑन डिस्प्यूटिंग कि ओके आपको बुरा लग रहा है उसने ऐसा किया, राइट, वो ऐसा कर सकता है, राइट, ओके मुझे हाँ यार वो ऐसा तो कर सकता है, एंड गो होम. ठीक है. ओके. नेक्स्ट टाइम when that person behaves in the same way, what do you feel, what will happen? Will I not react? If the person is keep going on doing the same thing and I know it make me feel sad and I know that I can't change that person, okay, will it help me emotionally? No, because what is remaining here, क्या छूट रहा है? उसके प्रति मेरा इमोशन विच आई एम प्रोटेक्टिंग. आई एम नॉट टेलिंग द. ठीक है ना? सुनाई आ रहा है ना सबको? हाँ. सो व्हाट आई एम ट्राइंग टू प्रोटेक्ट इज आई एम ट्राइंग टू प्रोटेक्ट यू फ्रॉम माई एंगर. नाउ क्वेश्चन इज हु आर द पीपल इन आवर लाइफ whom we protect? Close, specific, more specific.
uh, he is protecting her because he chose to love her and he does not want to leave her.
Yeah, I'm trying to protect that person from my anger, right? I don't want to be angry on that person.
So indirectly, I am protecting my.
No, I'm just protecting that person because that person is important to me. My question is, life में हम किसे protect करते हैं? Which are these people in our life whom we protect? Man said close one, loved one, right? Dependent, protective. Who are protective us? Who are protective towards us? Parents. Second, spouse. Right? So remember, बहुत बार when it is about your mother, it is about your dad, father, or about your husband who is protective to us. I am talking about female who is dependent, right? Who is not independent, financially dependent. Now the husband is a protective figure. So whenever we are talking about someone who is protective in the role, we will protect that person from our emotion, real emotion, anger. Okay? And that's why many times parent-child issues stay as it is, years together. Correct? Let's finish this and then I will give you one more example about this. Okay, go ahead.
I actually
दूर 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 हाँ.
that's your thought, but your thought is not a feeling. So if we look under the thought, what is the feeling towards it?
I'm sure after we make love the next time, she will forget everything she said to me, and then everything will be fine.
Coming back to present, what is the feeling towards her for verbally abusing you?
I feel scared.
That's the inner anxiety. But anxiety is not your feeling. Anxiety is how you cover your feeling. So if we look underneath the anxiety, what's the feeling towards her?
I feel irritated.
He irritated you, she irritated you. That's what she did. So what is the feeling towards her for verbally abusing you?
Let me tell you about the television show I saw last night because the same thing happened here.
If we don't go off the television show, what is the feeling towards her for verbally abusing you?
I don't think I felt anything.
But now as we look at this, what is the feeling towards her for verbally abusing you?
I have warm feelings toward her.
You have warm feeling towards her for verbally abusing you.
I feel things.
That's your anxiety. If you look under the tension, what is the feeling towards her?
She treated me decisively.
Yes, she did. So what is your feeling towards her for doing that?
I feel exasperated.
Exasperated is vague. What is the feeling towards her for verbally abusing you?
Well, even in the restaurant.
If you don't go out to the restaurant, what is the feeling towards her?
I feel nervous.
That's your anxiety. But anxiety is not your feeling. Anxiety is how you cover your feeling. If you look under the anxiety, what is the feeling towards her?
My girlfriend said I should be angry.
And you, in your opinion, what is the feeling towards her for verbally abusing you?
I couldn't say anything to her then because we were in the middle of a church service.
But now, what is the feeling towards her for verbally abusing you?
After she said those things in church, I excused myself and walked away.
That's what you did. And now, what is the feeling towards her now?
There are so many possibilities given the complexity of our relationship and our history together.
Possibilities is vague. If you remain vague, we won't get a clear picture of your feeling. So, what is the feeling towards her for verbally abusing you?
I feel defined.
That's your thought, but your thought is not your feeling. If we look under this thought, what is the feeling towards her for verbally abusing you?
I feel that the reason she did that was that she was not in a good mood.
That's your thought, but your thought is not a feeling. So if we look under this thought, what is the feeling towards her?
I wasn't angry.
You say you weren't angry, but what is the feeling towards her for verbally abusing you?
I feel angry.
How do you experience that anger physically in your body right now?
Yeah, that's it. While we were asking him question, okay, he almost read 3 pages, right? He was keep giving you defense, anxiety, shifting again to defense, again anxiety, defense, again anxiety. How you felt while we were asking him?
Um, Frankly, I was feeling curious in a sense that how can I ask some other ways to answer
Yeah, but you were asking very correctly. You said that example, that's your thought, but your thought is not a feeling. So if you look under the thought, what is the feeling towards him for verbally abusing you? You are getting curious. Okay, you are getting a bit of what I can do more,
yes.
kind of
How can
restless.
I help
Yeah, but sometimes this lead to what kind of emotion?
frustration?
Frustration. Okay, and if we get frustrated, what will project on the client? What we will project?
We are not understanding them
नहीं,
properly.
what emotion I will project अगर मुझे ही anger, yeah, and what it will do to the relationship, client therapist का relationship है, if I project anger what will happen? हाँ शायद भाग होता है ऐसा. इन माई प्रैक्टिस आई हियर दैट थेरेपिस्ट ने मुझे बोल दिया कि तेरा कुछ नहीं हो सकता, तू घर जा. होता है बिकॉज इन दिस प्रोसेस what we do, we get frustrated because the client is not giving me real feeling. Patient client is not giving me real specific example. At this moment, as a therapist, I need to understand that he is resisting. And if client is resisting, can I do anything? No. If client don't want to take help, if client goes on giving defense again and again and again, anxiety defense, so if this happen again and again, I get frustrated, then it will affect my alliance. So I just need to understand he is resisting, I just need to sit back. I don't need to push. Sometimes we push a lot. Okay. In your real practice, will it be able to say like this that let's keep the restaurant off, tell me about your feeling. Okay, why?
That way, the client may feel that I'm rejecting this period.
होता है ऐसा. And what will end up into listening stories.
Yes.
एक घंटा पेशेंट स्टोरी सुना के चला जाएगा, फिर आएगा, फिर स्टोरी सुनाएगा, एंड दिस विल गो ऑन. एट द एंड ऑफ 5-6 सेशन पेशेंट क्या कहेगा? हाँ, हाँ, बट क्या कहेगा पेशेंट अपने बारे में? कुछ फायदा नहीं हुआ. मैडम के 5 सेशन लिए, वो बस सुनती थी और मैं जाता था और रियलाइजेशन वैसे रह गया. पॉइंट इज, if my thought are clear कि patient is giving defense, if my thought are clear कि patient is giving me anxiety, if I'm doing correct thing, I should not be anxious. I should not be anxious in the counseling session. I should be okay. He is resisting, fine. I will just tell you, you are just not able to give me specific feeling. You are not giving me specific example. So unless you give it, we can't help. That may give client a idea कि अरे मेरा कुछ तो गलत हो रहा है, and he may come back. While answering, while you answered, how you felt as a client?
I feel frustrated that I'm telling her and she's immediately asking.
Yeah, but when you focused on the statement like if therapist is saying let's try to listen to it again, if we don't go off to the television show, what is the feeling towards her for verbally abusing you? Hey, just listen for it. If the client is telling you, you said, I feel irritated. She irritated you. Okay? And that's what she did to you. But can you tell me what is the real feeling towards her for doing that? Will you feel irritated listening to this? Yes? Okay. Point is, if I'm able to break the defense properly, okay, it will help the client. Even if there is mild irritation because I am repeating again and again, but it will help the client. Okay, thank you. So this is how patient goes on giving defense, anxiety, and as a therapist, we just need to identify what is giving. Is he giving me defense or is he giving me anxiety, and stick to my protocol. Okay. ट्रांसफरेंस क्या होता है? व्हाट इज अ ट्रांसफरेंस? Client reflect their feeling to me.
Clients reflect their emotions over therapy.
Okay, she is saying transference is client reflecting her emotion towards therapist. और कोई आंसर है?
And
Trans.
we do not need any
No, what is a transference? Tell me that.
whatever do we should share.
No, what is transference? She said transference is the client express feeling toward the therapist.
of someone who on whom they are
But does the client really express it?
expressed.
Yeah, so
They kind of identify them as someone they
yes, and that is transference. So what I'm doing, I'm projecting certain emotion on the therapist. Okay? And counter transference is,
just
yeah. Okay? Why it happens? क्यों होता है?
sometimes they look like someone or talk like
Yeah, sometimes they look like someone or talk like someone, which triggers us. And
maybe the problems like they are similar therapists are to like we are talking about.
no, 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 no. That is counter transference. When transference emotions come from therapist. Actually, whenever you go to anyone, you project something on that person. जब क्लाइंट भी हमारे पास आते हैं, क्लाइंट में प्रोजेक्ट अ फादर फिगर ऑन यू, client may project a mother figure on you, or a sister figure, or a brother figure, or as a partner. Client will keep doing that. Okay. And there are certain thoughts behind it. I will tell you one story. Uh, one 24, 25-year-old girl, okay, she was going through lot of anger issues. Okay, and this anger was getting projected on the boyfriend. The relationship was not going good. Okay. So, how we assess this? As a therapist, I would ask during the session, what are you feeling at this moment sitting on this chair? Is there any emotion you are feeling towards me? Direct question. And then patient do answer. The girl, 25-year-old who was having issues, she used to come suited. Means she will wear proper suit, jacket, and like a CEO of a company, she will always dress up like that. She will come to therapy. One day I asked her that what exactly you are feeling at this moment when we are talking. She asked me, "What do you mean by this? आप पूछना क्या चाहते हैं?" I told her that is there something you are feeling at this moment when you are talking? She thought for a moment and she gave this answer, which was very surprising. She said, इसके बाद में मुझे कहीं नहीं जाना है, मैं बस आपको मिलने आई हूँ, फिर भी इतना सूट पहन के आई हूँ. तो जब आपने पूछा अंडरस्टूड ये सूट मैंने क्यों पहना है. सो दिस आई वेयर एज अ गार्ड that you should not be able to see me, right? Many times when patient go on defense, actually that person is trying to protect himself from you also. Maybe you mean something, some image in her life. So the client will try to protect her. When I asked her, she was clear, कि अरे ये हो रहा है, and she was able to process it. But imagine if you don't try to understand this, what will happen? She will keep protecting herself. She will never open up her emotions, right? So this is how transference. ये बस हम पढ़ते हैं transference, counter transference, but it is very practical. It happens. आप जब भी किसी से बात करते हो, you project something. Right? Even here, if you are listening to me, you are projecting something on me. It happens, and this is subconscious. We don't know what is happening. And psychodynamic is all about awareness, creating awareness how what I'm feeling at this moment, what I'm projecting at this moment. And the outcome is we go on defense. Transference is also kind of defense. Okay, can it happen that at any moment you can feel two emotion. Can it happen? Yes. Any specific example you can give me? Anyone? Yeah. You tell me specific situation and the emotion. Okay. Huh.
So there is my really close friend, and we have been close for almost 7 years. So she tried very hard to meet और उसका नहीं हुआ. So उसके parents agree कर इस बात पे कि वो उसको abroad भेजा देंगे. So I know ये उसका बचपन का dream है. उसको पढ़ना है medicine. So I was so happy when I heard the news that her parents got agreed कि हाँ आप abroad चले जाओ. But at the same time I'm very heartbroken. कि वो जाते हैं. Seriously, I just started crying, and I know from inside that I'm happy. And
Yeah.
I'm so confused at that time.
Yeah. So you're feeling happy and sad at the same moment. Yeah. So these are the two different means happy and sad. These are two kind of emotion. So it is common to feel happy and sadness, but even we can feel the two negative emotion at the same moment. I will give you one example. Okay. So there was a marriage, husband wife, 14 years of marriage, and it was really abusive, verbally abusive, physically abusive. Okay. One day the husband just fall down and he had a heart attack. He died at that moment. And the wife then was obviously she lost her husband. She will feel sad. Okay. During the therapy, third, fourth session, what happens? Whenever she was telling this, I asked her what exactly you are feeling. She said, I feel jittery. When I express that my husband died, I feel jittery. Sadness, will it accompany with jitteriness or loose? क्या होगा? सैडनेस में क्या होगा? लूज. ऐसा होगा क्या? ऐसा कब होगा? एंगर. So I can see कि she is saying I am feeling sad, but what she is showing me is anger. Okay. On confronting that you are feeling like this, are you feeling racing heart? Yes. Are you feeling restless? Yes. सैडनेस में से रेस्टलेस नहीं होगा, है ना, स्लो डाउन हो जाएगा. She said there's something which nobody knows, and when my husband died I felt happy because he was always abusing me. For a moment I felt अच्छा हुआ मर गया. And because she felt that, now she was continuously angry on self. How I can feel this happy when my husband died? Guilty. Yeah. Because how I can feel that? Okay. Now tell me, if somebody is going through such a abusive marriage, 14, 15 years verbally, physically, and that person get a momentary relief कि अच्छा मैं छूट गई, is it wrong? But her ego was not allowing her to feel the anger, and that's why she was feeling guilty. Now tell me, if I'm not able to touch the guilt, if I'm not able to process the guilt, will it help her? No, right? So even if person tells us one emotion, we need to identify is there something else which her body is telling me, right? And if we are able to process it, then only it helps. Okay, correct? Okay. Exactly कितना बचा अभी? 39. Okay. So these are just exercises which we just मैंने ये एंड के लिए रखा था कि you can. Okay. मैंने ये एम के लिए रखा था कि वी विल आइडेंटिफाई, बट मोस्ट ऑफ दिस वी हैव डन because I also need to talk on OCD. Let me touch it for 20 minutes and so that we can cover it. वो रह जाएगा. Okay. About this psychodynamic, whatever I said, uh, one question I want to ask before going to OCD: what change this brings in your understanding? What we just heard for last 190 minutes, what change it brought in your mind?
I I am one who मतलब, I can take the charge of my own.
Yes, yeah. So accountability. Okay. Anything else? What change this 90 minutes of understanding brought in your mind?
Understanding the weakness.
Great. Defense, yes. Or uh,
And then
anxiety, yes.
we can kindly push trying to speak about this feeling.
Yeah, we can confront. We can confront if we are on a right way. What else?
Now we can understand the level of anxiety
Yeah,
and
yeah,
what exactly we should do that time. We
yeah.
recognize that what is really going on, when to
Yes.
stop, when to go on.
I'm so happy to hear this. Anything else? Any other understanding this 90 minutes brought in your mind? Huh.
The level of anxiety so
Okay.
that when we push the life
Yeah.
to work against the business of life,
Yeah. Okay.
what I have is not enough.
No, it is not. I can go on talking to you on this for 2 3 days.
We both
At least for 2 3 days, I can keep talking on this. Okay.
Client is feeling anxiety that should not be suppressed.
Yeah.
It should be, client should give attention.
Yes. Suppression. Suppression is the biggest issue.
So I had a question
Yeah.
about
Please.
online psychodynamic approach that anxiety should be brought to attention.
No. 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 See, if I see that you are getting anxious, I'm happy because it will tell me that I'm helping you to touch your subconscious emotion. Okay. So it is not about psychodynamic psychotherapy. It is, see, मैंने जो कुछ कहा, don't look at it कि ये psychodynamic psychotherapy है. Just look at it कि whenever you talk with anyone, you need to keep this in your mind. ओके, दिस इज नॉट एट ऑल साइकोडायनामिक. मैंने जो अभी बात की है, दिस इज हार्डली 2 to 3% ऑफ साइकोडायनामिक साइकोथेरेपी, हार्डली 2 to 3%. What I just tried to put in front of you, what are the barriers because of which we are not able to help the client, and how in our mind we play with emotion which create the barriers, and this is all subconscious. Nobody does that in a awareness. Okay. Okay, we'll just switch to OCD for some time before ending it. Okay. See, this is what I thought कि मुझे ना साइकोडायनिक पे ना कम से कम 1.5 2 घंटा लगेगा. That's why I request him कि we'll combine 2 hours because OCD मैंने नहीं बोला तो I would be happy. But this is what I wanted to put because OCD most of us know. आप यहाँ जाएंगे, just will rush it fast. अरे क्या हो रहा है इसको, आया नहीं इसको. Okay, OCD, obsessive compulsive disorder. Okay, next slide. What are obsessions? लिखा है, पढ़ लो. इमेजेस, इम्पल्सेस, थॉट्स. ओके, ये थॉट्स कोई मेरे दिमाग में डाल रहे हैं, मेरे खुद के हैं, मेरे खुद के हैं. ओके, कैसे हैं? इंट्रूसिव. इंट्रूसिव मीन्स मैं उसको धकेल रहा हूं बट वो फिर भी अंदर आ रहा है. रिपीटेड. बार बार आता है. It doesn't help me stop. What happens when I get this thought? I get anxious, restless. Correct? Obsessions. It can be image, it can be thought, or it can be impulse. Thought that मेरा हाथ गंदा है. Thought that शायद मैं घर गया ये दरवाजा खुला ही रह गया. ओके, शायद मेरी गाड़ी को ताला ही नहीं लगा है. ओके, image, some sexual image, some blasphemous image, something about God which is very wrong according to my conscience. Impulse, any example of impulse? Obsessive impulse? या मैं किसी को धक्का दे दूंगा, मैं किसी को मार दूंगा, राइट? Very common that after postpartum, if mother is depressed, mother get a thought ki I may do something to my child. Impulse. Okay, next. Types. Contamination, clear,